Welcome to the Paytient Podcast, a series of conversations with innovators, HR leaders, and benefit advisors about how they're solving benefit challenges and building healthier communities by helping people access and afford healthcare.
Hi there, I'm Laura Cave. J.R. Clark is with me today, and today we are excited to welcome Chris Labrecque. He is Paytient's new Chief Customer Officer, and he's here for a conversation about sort of the strategic use cases, the impact, the ROI for Paytient's health payment account. This episode is a little bit of a follow-up from our episode from the first of the year, where we explained a little bit more about what an HPA is, how it works, and if you haven't heard that episode yet, I'd highly recommend checking it out. That said, there's a difference between knowing what a solution is and knowing how to apply it. And I've been using this analogy somewhat at my own risk, but it's kind of like having a basketball. Sports analogies, getting risky here. It's kind of like having a basketball, but not knowing what kind of offense or defense you're running, or if it's going to help you win the game. And there's not much use for a basketball unless you know those things. So, JR, I know that you've been spending a lot of time on the basketball court with your daughter this year. I know she's been playing a lot. Am I making any sense? Tell me what you think.
Yeah, yes, yes, Laura. I have been spending a lot of time in the basketball court this year. It's the first year of competitive basketball and like 40 games in the season. So yes, sports analogies are good. I think you are right in the way that you are characterizing this. So, when I think about Paytient specifically, I do spend a lot of time with partners, and those partners are typically contemplating like kind of what the Paytient solution can do for them. And it's really interesting how each one has a unique perspective in the way that they see a fit for Paytient. So to keep with your sports metaphor, some are running kind of an offensive strategy and thinking about trying to attract or retain employees. Mm-hmm. Others really are kind of trying to be on the defense. And so they're really just thinking about things like, well, wait, we've just been hit with a health plan rate increase, and we're trying to figure out how to offset that and have a way to help employees cope with any of their rising out-of-pocket costs. So really some, when you think about it too, are also just really trying to make the most of their existing benefits or point solutions that they offer and trying to remove cost barriers in that scenario. So really, when we think about this, and I'm excited because Chris joining Paytient recently, it's really cool to have him with us here because, not only has he been in on a lot of client meetings to discuss this kind of thing here with Paytient for the last few months, but he also has 30 years under his belt as a benefits advisor, actually being in the trenches and